So thank you everybody for joining us today. This is a presentation about introducing a carer passport within a mental health trust, and this is a piece of work that has been undertaken by ourselves at Carers Trust and our partners at Carers UK, funded by the Department for Health and Social Care. And so over the last year we've been looking at developing guidance and resources for how a carer passport may run within 5 different areas. So one of which is mental health trusts, the other of which is hospitals, so community health hospitals, in education, so schools, colleges and universities, how a carer passport could be run for employers, and within community organisations. So this is the webinar today for carer passport in mental health trusts. So the first question is, and what a lot of people asked when we first started saying about carer passport is, what is a carer's passport? And so a carer passport is a tool which sets out the clear offer to carers and facilitates access to this support. It's a system by which a carer's information, needs and history are stored by the trust and facilitates smooth and consistent access into appropriate support. And it looks to bring together good work already being undertaken within the trust and build on it. I think the most important element of it is that it provides a clear pathway for carers and a formalised structure so that they can get through to the support that they need, and gives them an equal opportunity for support and partnership working. And one of the useful things that a carer passport can be used for is to achieve parity of carer experience across the trust. So although there may be episodes of good practice in different parts of the trust, this can actually be quite a nice way to ensure that a carer is getting the same service no matter what no matter which team they are accessing. And the passport may be owned by the trust, or it might be delivered in partnership with other agencies and services. So that could be with a carer centre, for example. It could be a carer passport that would originate within a carer centre and travel throughout the mental health trust, or it could be with other partners such as primary care or the local authority. So how does a carer passport work? What we found with mental health trusts is actually, in the mental health trusts who responded to us when we were researching this piece of work, was that nobody had implemented a carer passport, which is quite nice because that means there's lots of creative ways that people could go off in. So how a carer passport works or looks might be different in each trust, and some may have a physical card or a passport that carers would present to staff to identify them as carers, whereas others may have an app or a number which accesses the passport information. But as a basic, as what all carer passports should include and what they should help to do is to identify carers, provide clear co-productive working practices, so that is provide a clear offer of how carers can be involved in support, how they can be involved within influencing the trust, both at a sort of operational and a strategic level, provide clear confidentiality and information sharing procedures, and tell carers what they can expect from the trust. So a number of trusts have developed carers charters or carer strategies, and that's really to give carers an idea of what they can expect from the trust, and how they want to work with them going forward. And the carer passport can really support with that by helping them to navigate, and also provide clear pathways to advice, support and information. So that's both internally and externally. So within a trust, you may have a carer service or some carer groups. You could have referrals into talking therapies or to the recovery college, but also looking at those external things. How would you refer for a carer's assessment, referring to your local carer support service, any kind of advocacy, any of those kinds of things. So, what are the benefits of a carer passport? They are many and numerous, but the main benefits for carers are earlier identification leading to prompt support, helping prevent crisis and maintaining the carer's own physical and mental well-being. Some research that Carers UK undertook a few years ago showed that 28% of carers of people with a mental health need take 5 or more years to be identified as a carer and identify themselves as a carer. And obviously there's a lot of support out there for carers. There are carer assessments, carer organisations, advocacy, but if you don't know that you're a carer, you can't can't get access to them. So the biggest benefit and the biggest initial benefit to a carer passport would actually be that identification, and that identification at the earliest point, so that people can get support. They can get all of the information that they need so they can care while looking after themselves, and supporting their own ability to be able to maintain a life alongside caring. Increased co-productive work and ensures carers are recognised and valued in their caring role and are treated as equal partners in care. And I think if you think about a service user and carer journey, a person may develop a mental health need and their family members providing support, or their friends are providing support and becoming a carer. And so for the vast majority of that time, that person will either be self-managing their own support, or the carer will be providing support to them. And so they will only access services at certain points during that. But the vast majority of the time, they will be a group and they will be a partnership working together. So what traditionally could happen within services would be that a person who's using services would have a good relationship with their carer, would be providing support. Maybe they'd enter services and that would break down a little bit because the service was concerned about information sharing, or maybe there'd been a little bit of conflict. And so the most important thing at that point was to try and, from the carer's point of view at that point, they were fully involved with somebody's care before they entered the service, and now they don't have any involvement. They don't know what's going on. They don't know what the treatment plan is going to be. They may not know what the discharge plan is going to be. So by working in partnership with carers, people who are using services, and staff, the experience for the person can be so much better, and the outcomes for everybody can be so much better. So how a carer passport can support with that is that the carer will be recognised and valued throughout the entire organisation, and the passport itself will identify to a staff member and identify how they can support that carer and how the carer can be involved in that person's support. And increased information about diagnoses and treatments, supporting the carer in their caring role and protecting their relationship with the person that they care for. So carers aren't trained mental health professionals, and when somebody develops a mental health need, the carer may not understand what it is. There's a lot of stigma around mental health and a lot of myths, and so they may not understand issues around why the person is behaving in a certain way. They may not understand, particularly if somebody is experiencing psychosis, they may not understand how to be able to relate to that person. And so giving carers that information about what a diagnosis is, how you can support people, how to deal with certain behaviours, strategies for support, and how treatments can affect people, and the importance of the different kinds of treatments will help the carer to support that person when they're no longer in contact with that service. And it will also help to protect the relationship with the person that they care for. And this is where we find a lot of issues around carers and people with mental health needs, is actually that the person supported may be experiencing some things, and because the carer doesn't understand them, they become afraid. So the classic thing of oh no, of course you can't hear any voices, don't be silly. And so that person who is experiencing those voices feels as if their needs are being, or their experiences are being denied by the carer, and that can cause conflict. So the more the carer knows about a diagnosis, about treatments, about the plan going forwards, the better able they are to support that person and support them in a useful way. So what are the benefits of a carer passport for people who use services? Well, the most obvious one is that a continuity of care and support between formal and informal support. So if we think back again about the service user and carer journey that we were speaking about a little while ago, we'll think about that person as being supported by a carer at home, maybe for a few years, and then comes into contact with services. And the person who's been providing the vast majority of support during the last 2 years at that point needs to be involved and needs to know, and they have a lot of information that they can share about that person, but also a lot of things that they can learn about how to support them as well. And so similarly, all throughout, whether it's an admission or contact with a community team, there'll be things and learning that can go both ways. When it comes times to discharge or discharge planning, thinking about discharging, then a plan needs to be put in place. What would happen if there was a crisis arose? What are the plans going forward? Is the carer in a situation where they can provide that enhanced support that somebody might need upon discharge from a service? So that continuity of care for a person who's using a service will be really useful and can help to avoid any sort of relapse. The carers will also be better informed and can support them to remain well for longer. We touched on it a little bit in the last slide, but if carers can't be expected to know things without having had access to information. So when carers are better informed about symptoms or about how a diagnosis can affect people and are taught strategies about how to support somebody better, that can support the person to remain well for longer also. And confidentiality issues can be addressed early with agreements made, reducing the possibility of conflict during acute episodes. That will also help to streamline transitions and help with discharge planning. So one of the really big positives from a carer passport, if somebody was signing up to a carer passport scheme, it prompts a conversation early on about how involved somebody can be with someone else's care. So an agreement made at a very early point that talks about what degree of information should be shared, what kind of information can be shared and who it can be shared with can really help later on, particularly if there is a period of crisis or somebody's during an acute episode, that their views about who they would like their information shared with, how much information they would like shared can be really useful. And so the benefits of Carer Passport for mental health services are that it can clarify identification, referral and information procedures within the organisation. And this is something that would come up quite a lot, that services would really support and really enjoy some more guidance around is, how do you identify carers? What are the processes to be able to identify carers, and how can you ensure that happens across the board and not just bits of good practice within teams? So having a carer passport that carers can sign up to, accessible service that staff can refer to be able to find out information about a carer, something that has something in there about a referral. How do you make a referral for a carer's assessment? How do you make a referral to the local carer service? If you have a particularly swish system, it might automatically generate these kinds of referrals, and you could also store confidentiality and information sharing information on there as well. It's also an opportunity to gain additional insight into the person using the service and what support they have in their families and the people around them. And how this can particularly help over the years when I've spoken with services, those who've engaged with families and sort of gotten the information from families have said how it can be really useful, especially when it comes to something like discharge planning or transitioning from one service to another, to know that bit of family information that the person themselves may not think to share. But actually, if you were thinking about discharging somebody from a community mental health team, but actually it's that month that they lost somebody, or it's the anniversary of having lost somebody, or there's an extremely stressful time coming up, having that information from carers and being able then to plan an effective discharge can help any signs of relapse or that person having a much more difficult time of it than they would need to have. And it helps with overcoming communication difficulties. And that's, from what we said before, if at the earliest point conversations are had about confidentiality and what information people are happy to share, things going forward, then this can actually help with risk planning and reduce the risk of serious incidents and improving patient safety. And I know at the moment there's quite a big focus on serious incidents and how to reduce them across the board. And one of the things that was quite interesting, the National Confidential Inquiry into Suicide and Homicide had detailed in their annual report in 2015 that in England they'd spoken with mental health teams, and the impressions of the teams within England were that in about 16% of cases where a person had lost their life to suicide, and 28% of cases where somebody who had a mental health need had committed a homicide, they actually felt that increased working with families would have reduced the likelihood of that. And so this is actually a piece of work, although a carer passport may seem like a small start and just, sort of an administrative system, actually it can help to kickstart a whole new different way of working and a whole new different culture of work, and that can actually help to save lives in the long run. So I think overcoming those communication difficulties, making it very clear for everybody what everybody's expectations are and how they can contribute that information to one another, can really help with all of the targets that mental health services have about improving safety and improving outcomes and preventing serious incidents. So, tips for success. The first thing that we'll always say is that if you're thinking about implementing a carer passport, it needs to be, from the very first second that you do it, planned, developed and delivered in full partnership with carers and carer partner organisations. And so they're actually two separate but linked groups. So developed and delivered in full partnership with carers is obviously very important. If you are producing a service for somebody, then the first thing that you want to do is find out if they find it useful in the first place, and then also how they would like to do it. So we have administered a scheme called a Triangle of Care, which I'll explain a little bit about later. But for the last 7 years, we've worked quite closely with mental health trusts around increasing their engagement with carers. And one of the interesting things that's come up a few times would be that a trust would implement a service such as a weekly tea party, possibly on a ward, or maybe within a community team they would implement a monthly garden party, and in some of those the uptake from carers was actually really small, and so staff members were quite confused about, we're putting all of this on and carers don't want it. And then when they started to engage more with carers, they found out that carers are really happy to engage, but that's not the way they want to do it. We also, as part of our research in looking at how a care passport could run within a mental health trust, worked with quite a few carers, and we got no consensus from the group of carers that we spoke with about things between whether they would like a physical passport or whether they'd like an app, whether they would like to be named on the passport, or whether they would like some sort of a number that would identify them. And so actually that's why it's so important to go and work with your groups of carers, work with local groups of carers, even if you're not necessarily supporting them directly as a trust, to be able to get an idea about what a carer passport would cover, how it would be administered, how it would be monitored, and what the use and what the outcomes of it could be. So always, if you're doing something for people, do it with them. The other part of that as well with carer partner organisations, if you implement a carer passport and you identify 200 carers in your first 6 months, identifying the carers and having a carer record or something within your system is obviously really useful internally, but the support that they'll need won't necessarily be provided by your trust, and the most obvious service who will actually provide that will be your local carer partner organisation. And depending on what area you're in and what the contracts are in those areas, they could be the people who will also complete the carers assessments, or that could be done by the local authority or another organisation. So the most important thing really, if you're thinking about starting up a carer passport scheme, would be to speak with your local carer partner organisations to see how you would refer into them, what kind of resources they have available. If you make 200 referrals in a month, are they going to be able to process 200 referrals in a month? Do they have the knowledge within their own service? Is there anything that their staff need, maybe to build up a little bit more knowledge about specific needs of carers of people with mental health needs? And that can actually have a reverse helpful effect for yourselves, because it could be that the carers service needs a little bit of support around specific mental health knowledge, and your trust needs a little bit of information about specific carer knowledge. That can actually be a skill swap that you can arrange. And so actually then working in partnership with your local carer partner organisation and the local authority, if they're the one who do the carers assessments, and really planning how it can be delivered on a sustainable and useful basis. Also, an extremely important thing to do is don't forget young carers and young adult carers. So anytime we've said the word carer during this, or I've said the word carer during this presentation, I have meant all carers of all ages. And young carers and young adult carers are always particularly more hidden. You may not come in contact very often with young carers and young adult carers, but if you are aware of them and in contact with parent carers who have children, or people who have mental health needs who have children, it is definitely worth engaging with a group of young carers or young adult carers about how a carer passport system could work for them as well. And the same thing would apply as to get in touch with your local young carer organisation or young carer group and see how that would work and what kind of things they would need. Because the needs of young carers and the information that would be provided to them may be different than adult carer passports. And so you would just need to think about that. So if you're thinking about building a carer passport system, don't think about necessarily building two completely different systems, but actually just thinking about how you could vary a carer passport for a young carer, a young adult carer, or an adult carer, and also how they would transition between those. Another important thing really would be to invest in training staff in carer awareness and carer passports. It's extremely difficult to identify carers if you don't know what they look like, if you don't know what they are, or how to identify a carer in the first place. So if your organisation is thinking about implementing a carer passport, it's really worth investing in your staff. I remember when we were doing some research about this, although we didn't find any trusts who had experience themselves of implementing a carer passport, we did have trusts who spoke to us about implementation of other passports, either within local services or within their own trust. And a number of people spoke about some learning disability passports that had been piloted within their trusts and how they were fantastic passports. And they contained all the information that you would need and would be really useful, but that staff weren't aware of them on a local basis. They didn't really know what to do with any of the information contained in them, and though it was a really fantastic resource, it didn't actually come with any associated positive outcomes for people with learning disabilities. So I think there are things to learn there and think about before you're even implementing a carer passport. What do your staff need to be able to know? Do they need to know how to identify a carer, what the local services are, and how to support somebody through a carer passport? Which leads us on to the next most important point, is to obtain buy-in and commitment at all levels of the trust. So as I think as said before, we implement the triangle of care within Carers Trust, and we support 33 trusts across the country to implement it within their services. And what we've found is that you need to have buy-in at all levels. So at a strategic level, obviously, you need support to be able to put the resources into making a change within the organisation. You need to have an idea about how that's going to work across the whole of the organisation and how it's going to be rolled out. But you also need that frontline buy-in, because although at a strategic level, that's fantastic, if actually it's not filtering down to people who are having the main contact with carers, then they need to be able to deliver that service to carers, so they need to be bought in as well. They need to understand why it is a priority and why this is an important piece of work to do. And one area, when we talk about strategic and operational, one area that people tend to forget is around managerial, and particularly around middle management. So they may have strategic managers who are saying, this is a fantastic piece of work that we can take forward. They may have staff on the ground who are saying, yeah, this is a really useful piece of work, but they need to be really bought in. They need to really understand the vision of why they're able to move things forward. They need to have the resources to be able to support the frontline staff to really implement this. And they need to have the drive to be able to take it through. And so the last top tip would be to work with local partners, and so that's primary care, local authorities, local carers services, and keep them up to date with your plans. If they're planning to implement their own carer passports, then actually what can be fantastic would be a carer passport that would jump between services. Now, there are a number of challenges, particularly around IT systems around that, but I know in some areas people are already looking into how that might be able to be navigated, and even if the carer passport doesn't necessarily truly jump between services, how the interactions with other agencies will be. And as I say, we have developed guides for a lot of local and national services and organisations. So they themselves might be thinking, for instance, your local community health hospital might be thinking of implementing a carer passport. If that is the case, and you're thinking about implementing it, it's worth putting your heads together and thinking about if a person that you're supporting under your mental health trust had to go into a hospital, how the carer passport from your mental health trust could follow the carer supporting the person into a community health hospital. And so throughout the piece of work that we've been doing, we've had a few frequently asked questions. We will be opening up to questions at the end as well, but these are the things that have come up most often. So this is quite often asked by carers, and it's, does it have to be a physical passport? Will I have to go and have passport photos done? Will I be allowed to smile on them? And so no, the answer is no. It doesn't necessarily have to be a physical passport at all. Some carers raised concerns that they didn't want a piece of a card that had their name and the person they care for on, in case they lost their purse and somebody got hold of that information, especially if it has any kind of contact details. So again, that just reiterates how important it is to make sure that carers are fully involved from day one. So it could well be, I know within some trusts, and there are lots of different IT systems such as System 1 and Rio and Care Notes, so there's no guidance that we could give that would cover all of those things, but a lot of systems do have the ability to add a carer record, and that carer record can be linked to a service user's record. And so it could be that there would be a identifying number on a carer record, and so if a carer said, oh, I have a passport, my passport number is this, then a staff member could go on, access the carer record, access information to the confidentiality and information sharing, see if they've been offered a carer's assessment, and if not, make a referral, see if they're tapped into their local carers support services, see if they've got information about advocacy and advice. So it's not necessary to have a physical passport, although some people would really it would be really useful for that, and particularly if your IT system, it still needs a little bit of work and a little bit of development, then it can be useful just to have something that would identify a carer as such, and point staff towards where they can gain more information. So the other question that we're asked quite often by carers is, I'm a carer. If the trust that I support, who supports the person I care for, implements a carer passport, do I have to have one? And the answer to that is no. Nobody can be forced to have a carer passport. It can be a really useful system and a nice way of navigating through a mental health trust. However, it shouldn't be mandatory that a carer has to have a carer passport, or nobody can engage with them, identify them, or refer them on. So I think as well, this is one of the things that it's useful if you're thinking about implementing a passport to really have conversations about fairly early on with carers who say that they wouldn't particularly, for whatever reason, they wouldn't particularly want a carer passport, and what elements of a passport would they find attractive, and then alternative ways of being able to access those. So for instance, you could still make a referral to a local carer service, or you could still make a referral for a carer's assessment, but you wouldn't necessarily hold that carer's information centrally. This is one that came up very often. So what is the difference between a carer discount card, carer emergency card, and a carer passport? So the best way to explain that is probably to explain what a carer discount card and a carer emergency card is. So a carer discount card is often a card that will identify somebody as a carer, and then they would get discounts, and that could be within statutory services, so that could be discounts on parking in a mental health trust or a community hospital. That could be discounts on canteen food within NHS services. That could be discounts at the local shops, so 5% off at Boots. And with local services and products, so it could be 15% off when looking into planning wills or powers of attorney. And so those kinds of carer discount cards, or those carer discounts, although could be part of a carer passport, wouldn't actually serve to identify and give carers a way of being able to navigate throughout a mental health trust. So a carer discount card in itself wouldn't be a carer passport, but it may well be an element of a carer passport that a trust would develop, possibly in partnership with local businesses or local community organisations. Similarly, a carer emergency card is fantastic. We really like them, and they run, I think, in most local authorities, and that is a card which again identifies someone as a carer, but they tend to be used in an emergency where the carer possibly can't communicate, and so it's to highlight the fact that they are a carer and that there is somebody at home that they support, and if they don't return home. So for instance, if they were in an accident and had to go to hospital, people wouldn't necessarily know that that person is there, and support wouldn't necessarily go into place. So how a care emergency card usually works is that somebody will have a reference number on their card and a phone number to call. I think it's usually local social services. I think it usually runs through the Lifeline service, and so that person can phone social services, say that they found the carer emergency card, give the number, and then there will be details registered of 2 people who can provide support to that individual who the carer is caring for. And so those 2 people will get in touch. Failing that, it will be referred onto the duty service. So again, a really fantastic and useful element of a carer passport, but that in itself only has one area around crisis planning, and wouldn't necessarily help to navigate a carer throughout the whole of the way. So although carer discount cards and carer emergency cards are extremely useful things, they wouldn't be classed as a carer passport, because that carer passport starts at the earliest possible opportunity and follows somebody throughout all services. And the other thing that we got asked quite a lot, and particularly when we were doing the research element of it, is, well, there isn't a triangle of carer passport anyway. And no, it's not. But I'm aware on this call that not everybody will be familiar of what the triangle of care is. So I'm going to give a little bit of a brief overview and then explain how it's not a carer passport. So, what is the triangle of care? In a nutshell, it's this. So it's our best practice model of equal partnership working between carers, people using services, and professionals. And so the Triangle of Care was originally published in 2010, and it was the result of many years of work with a group of carers from Devon, and one in particular, Alan Worthington, had gone and engaged with a number of trusts because he wanted to improve the engagement between professionals and how professionals engaged with carers. And what he identified is that quite often when somebody would come into contact with services, the person who was using the service, that actually the relationship that they'd had with the carer could drop off, and the communication would tend to flow through the service user. So the professional would speak to the service user and ask them to pass information on to the carer, and then the carer would ask a question of the service user, who would then have to ask that question to the professional and go through. So the carers in Devon came up with this idea of a triangle of care, and that is the equal relationship between the service user, professional, and carer, with the flow of communication going back and forth between all 3 parties. And so it was originally released in 2010 for inpatient services, and then in 2013 it was developed to cover all universal mental health services. And so the Triangle of Care has 6 standards that can help to achieve this kind of relationship. So the standards are, and what I'll do in each of the standards as I go through, I'll explain it in the context of how a carer passport could support that, because there are a number of mental health trusts across the country who are either already implementing the triangle of care or who are planning to do so. So we currently have 34 members of the Triangle of Care membership scheme out of 54 trusts across England, and there are a number of trusts who are sort of in the planning stages of how they can do so. So how the Triangle of Care standards and how any kind of Triangle of Care work that you may be undertaking could dovetail with a carer passport would be that the first standard is that carers and the essential role they play are identified at first contact or as soon as possible thereafter. So obviously a carer passport helps with that identification, and it helps as early as possible. As soon as somebody is identified as a carer, they're offered a carer passport and offered to be able to do that. And the role that they are going through all of the confidentiality and how the information would be shared, their role and how important that is can be identified, and they can have their own views fed in to that person's support. Staff are care aware and trained in care engagement strategies. Obviously, a carer passport helps staff to be more carer aware, because if they are identifying carers and they're engaging with them on a more regular basis, then they'll actually begin to be slightly more trained up about being aware of carers' needs. When they're engaging more with carers, they'll hear more of their story and be able to empathise more. But I think one of the most important things in both the Triangle of Care and any carer passport scheme is making sure that that training is put in for staff. So actually, you may be trained to deal with people who have mental health needs and be able to support them with their mental health, but it is a completely different skill set for supporting carers, and their needs are not the same as the people that they are supporting. So I think it's one of those areas where people tend to assume, oh, if you provide support to people who have mental health needs, you can also support carers, and it's not. I've worked in both areas, so I promise you it's completely different set of skills, different set of knowledge, but isn't necessarily extremely difficult to be able to do. And policy, practice, protocols, RE confidentiality and sharing information are in place. I think specifically within mental health, confidentiality and information sharing comes up a lot, because when people become unwell, they may well decide or they may well believe that people around them are not the people that they thought that they were, and they can act out of character, and the relationships can change. So it is extremely important that these people still have a right to their own confidentiality, and a right to say who can have access to their information. But I think it's one of those things where people need a plan in place before a crisis to be able to say, during a crisis, I may feel that I don't want you to share information with this person or that person. However, this is the information that I'm happy for you to share. And that's where a carer passport can come in. Because if you already on the carer passport have all of the confidentiality agreements and consent to share information, and sort of review times of when you will relook at that and see if there are any changes, then that can really help to support that. And that if you are identifying a carer immediately and giving them a carer passport, that's from day one, that's all sorted, and that can really help to support that triadic relationship between people who are using services, carers and professionals. And defined posts responsible for carers are in place. So if you are setting up a carer passport scheme, it's actually really useful if you have strategic staff throughout your organisation who maybe know a little bit more about how to do it, or maybe they'll be the people who would manage signing people up for the scheme. So I think in a lot of the guidance that we produced, there are references to a carer lead or a carer champion, and the Triangle of Care programme that we run advocates that there should be a carer lead or champion within each team in a mental health trust, and those aren't the individuals who do all of the engagement with carers, and they're the only people who ever speak to carers, because obviously that's not a carer friendly service, that's just having somebody in post who deals with carers, but actually having those posts who would take the lead for each of the teams. So it could be be that they would be the people who authorise the carer passports, or it could be that they would be the people who monitor the uptake. And so if they notice that John made 10 referrals for a carer passport in a month, and Tom made 2, then they would actually engage with that staff member and see if there was something around confidence issue, or if there was any additional training needed to be done. So actually having those posts in place help to keep carers on the agenda, but also help to smooth the transition between different services. And a carer introduction to the service and staff is available with a relevant range of information across the care pathway. So if you were implementing a carer passport, one of the first things that you could do once a carer had been identified would be to send out an information pack about the trust and maybe some more specific information about that particular service. And actually what might be really nice, if you're looking at the carer passport detailing all of the individual needs that the carer may have, and an opportunity to be able to sit down and talk about information sharing and how they'd like to be involved, then it would be an introduction to the staff as well. So it would be a face-to-face, it would depend who is the most person, but maybe the care coordinator, maybe a clinician. Would be really good to have that face-to-face. And so the carer passport could actually be a way of sitting down, meeting one another, identifying expectations of one another, and building a really strong relationship going forward. And because the carer passport would follow a carer through the whole pathway, so if a carer passport, for instance, is implemented when somebody is admitted into inpatient, then that would transfer over to the home treatment team. And so when somebody was being supported no longer within inpatient and was being transported over to the home treatment team, the carer might need a different set of information. So they might be supporting somebody with their medication, so they'd need to know about, what some common side effects may be. If somebody doesn't take the medication, what side effects might occur there. And then once that person then was accessing the community mental health team, they'll have an entirely different set of information needs. So a carer passport can really help with this, especially for trusts who are implementing triangle of care, to be able to ensure that carers are given access to information and advice all the way through until the point that the person is no longer in contact with that service. And the 6 is that a range of carer support services is available, and quite often when I say this to trusts, they can get a little bit panicky because they think that the expectation will be that they will automatically start offering a full carer service and all services. And then, yes, it can be fantastic if you have opportunities to be able to run carers groups or provide some support specifically around supporting somebody with a mental health need. However, there are a whole range of carer support services out there. So local carer services, access carer assessments, the local recovery colleges. So I think the vast majority of recovery colleges now provide courses for carers to educate them about mental health needs and how to protect their own mental health. There's advocacy services. There's a wide range of support out there. And so a carer passport, if you've done the initial work of talking with local carer services and local community partners about how a carer passport could generate a referral to those services, then that can really help with helping a carer to navigate through to the support they need, even if it's not provided by your own service. So, if you're sitting there at the moment and you're thinking that your trust might be thinking about implementing a carer passport, and you'd like a little bit more advice, or you'd like to connect with other trusts, because there are a number of trusts who've gotten in contact with me already, who are interested in starting up or at least sort of thinking about it, then you can go to the Carer Passport website. So that's carerpassport.uk, and there'll be a link at the end of this webinar, and then there is an About tab, and if you click on that and set up a new carer passport scheme, you can register your interest, give us your details, and then we'll be happy to put people in touch with one another. If you have any specific questions, you can post them there and we can see if we have any answers. Failing that, we may come back to yourselves and just say, well, there are no answers because this hasn't been tried before, so what do you think might work? Do you want to try something? So we'll see if we have any questions. My colleague Cleo is here, So I don't think we've had any in chat. Okay. Okay, so somebody, Leo Bryan had asked, can we have a copy of the PowerPoint presentation? Yeah, that's fine. I can email that round to everybody. And what we'll be doing with the webinar is we'll be hosting that online as well. I don't know, Cleo, are there any more questions on chat? No? Okay. Does anybody have their hand up? Okay, so we have one question from Laura.
It's not a question. Hi there, it's Laura Bennett, Acting Head of Policy at Carers Trust here. It's not a question as such, but as we touched on the topic of young carers and young adult carers during the presentation, just to let colleagues on the call know that we are running some free events about improving the identification of young carers, and they're happening in Durham, Leeds and London across April. There's 3 events, and those are free events which would be incredibly suitable for health colleagues to help them improve that. We'll be talking about carer passports and the triangle of care at both of those events as well, more around tools. I'll copy the link into the chat box, and then I think we'll send that round as well, so just making colleagues aware of that. Thank you.
That's lovely. Thank you very much for that, Laura. And we've already had some feedback. Several members of Mental Health Trust have attended that training and have had really good feedback. So please do register for your place, because I know quite a few of them are quite busy. So get in there early. I think Caroline Mead, you had a question?
Hello, Sarah. I'm just wondering, are there any trusts who've already actually implemented the passport scheme?
No, from our research that we did, so we sent out questionnaires, and obviously any of the trusts that I've been working with more closely, we'd sent out and said, and a few people came back with carer discount schemes that they were aware of locally, that may have been called a carer passport, but no, to the best of our knowledge, it has not been implemented within mental health trusts at the moment.
Okay, thank you.
Thank you. We don't have anybody else with their hand up. There are 2 questions on chat. A copy of the audio. So Matthew, just so I know what you mean about the audio, is that the webinar? Hang on, yeah, 1 second. Okay, so sorry Matthew, I'm just trying to find you. Okay, Matthew, you're unmuted now. So is it the audio as in this webinar? No, he's still muted. Sorry about that. Oh, you're self-muted. So you can unmute yourself if you're still there. Well, anyway, access to the audio from this, so we will be hosting this webinar online, and we will send round everybody who's on the call today. We'll send round a link to where you can view this online, so if you want to come back to it later, at a later point, that's fine. How will this comply with GDPR if we decide to use a physical passport? So Sue, we've unmuted you. Do you want to give a little bit more information from that?
It's just that our organisation is looking at GDPR now, and we're looking at confidentiality and particularly signposting to other agencies. And if it was a physical passport, you might have the carer's details and the cared for details on. And it's about this explicit consent and how we would cope with it. I don't really know, especially across agencies as well, referring.
I think that is a really important point, and that is something that carers brought up quite often, and people who use services also brought up that what if a carer is happy to have their name on a carer passport but the person who's using the service isn't, and how do you do that in that way? I think one of the alternatives could possibly be to have some kind of identifying number, but also there is, under GDPR, there are considerations that need to be taken into place then about what if somebody got hold of that number, would they then be able to have access to that system to be able to identify somebody? So I think there isn't a hard and fast rule about it, but I think what would be the most important thing in the initial stages would be to engage with carers and people who are using services about what they would and wouldn't like, and then being very clear with people when you are signing up to a passport, or when they are signing up to a passport, exactly what information will be stored on the system, are they happy for that, and how they would like it to be done. So I think, yeah, it's one of those, it doesn't really have a hard and fast rule, and it does depend very much on your systems, but that may be an instance where a physical passport wouldn't necessarily be most appropriate, or actually just having somebody, a carer's name and a service user's name, and identifying information on that piece of paper or that card wouldn't necessarily be what is most secure for that person. So I'm sorry not to have a hard and fast answer for you. But it's one of those things. I mean, obviously there are lots of organisations that your bank card identifies your name and things like that. So I think it's more important, really, just to make sure that everybody has consented to have that information if it is there. Okay, we're just having a look at another question. So how long will carer passports last for? Does the carer have to request another every so often? So what we've done, we've made, and you'll see on carerpassport.uk, you'll see that there are resources, and we've made a little bit of a template of a carer passport, and on it we've got review dates. So again, that would be something that we haven't prescribed. I mean, we wouldn't suggest maybe leaving it to 5 years, but maybe on a regular basis, so maybe once every 2 or 3 years, that there is some kind of engagement with a carer, just to make sure that they are still caring, that all of the details that you hold for them are up to date, that working with the person that they support, you know, as the confidentiality and information sharing arrangement still the case, and really going in that kind of way. So we haven't prescribed that it definitely does or it doesn't need to be, but I think that's something that locally you can come up with something that still would make sure that the information that's contained on there is fresh, and it's a live record, as opposed to just something that was filled in 5 years ago by somebody, but also taking into account the fact that that could actually long term be quite an administrative process, and what's the best way to go about that. Okay, we have another question. Also, would other organisations tap into the carer passports like a bank, so in case the service user falls unwell, then the carer could help in some way, or utility companies? So definitely, I mean, it's one of those things, an absolutely A-star fantastic carer passport would start with in primary care as soon as somebody becomes a carer, and would actually jump in between different organisations. The practicalities of this can be extremely difficult. Everybody has different systems and different ways of recording, and different commissioners who ask for different information. So there is nothing to say that if a trust or a group of organisations locally is interested in implementing a carer passport, and especially making sure that there are interactions between those, and the passport can jump to some extent between organisations, then actually utility companies and banks could be a really useful one. I think there are some more complex rules around data protection there than maybe I have the expertise to be able to go into, but I think you can always, if you are thinking about implementing, and especially if there are a few organisations locally who are thinking about implementing a carer passport, it's worth pulling in people from a wide range just to make them aware of the fact that you're doing this, and then they can look at their systems and see how that would work also. So I hope that's answered your question. Please do raise your hand if it's not, or post in the chat. Do we have any more questions, Cleo? No? Okay. We don't have any more questions on there at the moment, but I'm aware that people are still muted. So what we can do, we can unmute people for a moment, but it might get a little bit noisy. If you have a question, if you wouldn't mind just saying your name So we're just currently unmuting everybody now. So if you say your name, and then I'll come to people in the order that they say their names. We're still unmuting people at the moment. There's quite a few people on the call, so if you are saying your name and I'm not responding, it's because I can't hear you just yet. And there are a few people who we have unmuted their mic, but it's muted from your sound. So your microphone is on the little console that's on the right-hand side. There should be a little circle with what looks like a little microphone in it. If it's red, then you're muted. So if you click on that, it should turn green and you could speak. So I think everybody we can unmute is unmuted now. Does anybody have any questions?
Hi Sarah, it's Lee from Cares Together.
Hi.
We're Cares Support Centre up in the North East at the moment. We're providing support to 5 providers. More of a comment than anything else. We've just supported Middlesbrough Council.
Sorry, Lee, I can barely hear you. You're sort of
Can you not hear me? It's all right. Can you hear me now?
That's a little. Can you hear me now? Yeah, that's a little bit better. Thanks.
So it's really just a comment more than anything, and just to wonder what other people are thinking. But we've just supported Middlesbrough Council with the working carer passport, which is very similar to what we're talking about, except this is obviously in a professional capacity. That was under the support of the HR department, and obviously we support with the HR department of the council with approximately about 2,000 people who are working carers.
Yeah.
We obviously need to think about, like you say, I think it's definitely the benefits of the carer passport and mental health service, but I'm wondering what the trusts are thinking with regards to the whole administering of this. Because it's got a lot of resource implications, I think, unless it was done by a carer centre, as you want to call it. But if you think about some of the trust areas, we could have 4 or 5 different carer centres in one area. And I'm just wondering how people thought it would be administered more than anything else.
If anyone's on from a mental health trust and has an answer to that. Everyone's gone kind of quiet. Yeah, sorry, my colleague just said it could be part of the coordination work locally. I mean, are there any tips from your experience of working with your local council, Lee, that you could offer out to anybody who's thinking about implementing it?
No, I think what it was is we've got quite a receptive council, really, who are up for carers and anything to do with carers. And it was about, I think, like you said earlier, it's about getting the buy-in. So we got the buy-in from the chief executive of the council, from the head of HR, and it wasn't really that big a job because they had this health and wellbeing passport. So we supported them, really. We kind of care-approved this passport to make sure that carers were included in it. So we've just finished a big piece of work with them. But I think you're right about the buy-in, and I just wonder where we get the buy-in when the trusts are so big. Do you know what I mean? Like, it's not just a case of, it was quite easy really because we just go to the head of HR or the director of HR.
I think there's usually a head of patient and carer experience or something like that, and they will possibly be a good ally to have the first conversations with. Depending on which trust it is, if they're a member of Triangle of Care, then actually they will have a strategic.
Triangle of Care. Yeah.
Sorry,
Sarah, sorry I spoke over you.
No, it's okay. What did you say?
No, I'm saying, yeah, our trust, the trust we work with, we have Triangle of Care all the time with them. But it's more of a logistical thing, really. And like I say, I was just wondering if anyone had any experience or had any discussions with the trusts about trying to implement something like this.
I think it still is quite new. I mean, this is the first webinar that we've done. The guidance is all quite new, so I think that'll be something that'll be emerging over the next few weeks and months. We have had a number of trusts who've gotten in contact with me since they knew that we were doing this piece of work and had said, oh, you know, when are the guides and the resources out? And that's why we've done this webinar, to just try and answer some of the initial questions as much as we can, and then actually how we can be put in touch. So I think definitely if you want to go to the Carer Passport site and say that you're interested, your organisation is interested in supporting anything that might be going on locally, but actually having those conversations and through the same contacts that you have around your work around Triangle of Care, you know, if they are considering implementing a Triangle of Care, a Carer Passport, then it's about looking at what there is locally and how you may be able to start that, and what we can do as well with those who've registered an interest with us, is we can actually put people in touch with one another and share those ideas. So,
yeah, it would be good to hear other people's experiences, I think, as we start trying to implement it with our trusts.
yeah, definitely. Lovely. Thanks very much for that,
Sarah.
Lee.
Yeah,
Cheers. Oh, sorry, somebody's alarm is going off. Paul, I hope you're okay. It looks like an alarm's going off. Sorry, we just had to mute you, but I do hope that you're physically well. We do have another question. Is it recommended that trusts you should start in-house and then think about rolling out further? Again, because we don't really have anybody who's done it before, we couldn't really say what would be the best way to do it or not. I think it may be, people always love a pilot, so it could be an idea to maybe run a small pilot within the trust. If you're really not sure about it, you're really not sure how things go. But actually, I think from day one, if you're going to go to the expense and the amount of work of developing a system, then actually seeing if it could intersect with other people's systems. So particularly your local carer service and local authority. Those, I think, would be the two big ones, because you're going to be making referrals to your local carer service. If your local carer service could detail the kinds of support that they're providing to that carer on an ongoing basis, and you could have access to that information because the Carer Passport has jumped from your service into their service, then that's going to make your life so much easier, and you're going to know that you don't have to signpost a carer to advocacy and things like that, because they are already being supported by those agencies. Similarly, within the Triangle of Care, we always say that every carer should be offered a carer's assessment, and we have not yet had any carers coming to us who are saying that they're sick and tired of being offered a carer's assessment, so we're not quite there yet. But again, what could be really useful would be if you had a Carer Passport that jumped to the local carer service from your organisation, to the local authority or whoever completes the carers assessments, and those details could be uploaded so you could see the support that will go in for carers and the support that they need and when their last review was, and you could highlight if their circumstances have changed. Again, the outcome for carers in that way would be improved, but we can't say that you should definitely do either way. I think it's very much in the earlier days of Triangle of Care. It's about trying to feel out what works and what doesn't, and that might be different in different areas. So I'm just seeing if we have any more questions now. So we don't have any more written questions. If anybody does have any more questions on the line, if you just say your name. Okay, so it sounds as if we don't have any further questions, and we have run over a little bit, so I think a few people have had to leave. So for more information, you can go to the Carer Passport website, which has guides and resources about all of the Carer Passport guides, but the specific mental health link is carerpassport.uk/mental-health. And if you're interested on Triangle of Care or you want any of those, I'm not going to read out that internet address, but quite often if you just Google Triangle of Care, well, always if you just Google Triangle of Care, it'll be the first link onto our professional site at Carers Trust. Thank you all very much for joining. It's been a really interesting discussion, and it's been really good as well to hear about other areas where other Carer Passports have been implemented. So please do go onto the Carer Passport site and register your interest if you're just, even if you're thinking about it, even if you're thinking about dipping your toe in it, and we can try to start to put people in touch and give a little bit of information and share some good practice. So thank you very much, and I look forward to speaking with you all soon.
Okay, thank you, Sarah. Thank you.
Thanks. Bye now.
Bye. Bye.